Hello and welcome to the last lecture in the Principles of Exercise Therapy, lecture 19. This one is on hydrotherapy, or the new term aquatic therapy. So sit back, relax and enjoy. This is our centering slide reminding us about what physiotherapy is. Our profession is concerned about human anatomy and physiology, human movement and function, maximizing wellness and potential, using the hydrotherapy or aquatic therapy, and then minimizing disease and injury. It's really all about solving real world problems. The principles of exercise therapy, we've given these to you every single session. You remember them with the acronym ASPORT-BILLY. So A is for adaptation, S for specificity, P for progression regression, O is for overload, R for reversibility, and T is for timeout. And then Billy, behavioral change, individuality, lifestyle integration, law of diminishing returns, and your responsibility. So in today's session, we're going to cover hydrotherapy or aquatic therapy, and what I want you to take home are the core components of hydro. Apply the principles of hydrotherapy to both groups and individuals, and then recall the different methods used within hydrotherapy. In more detail, I'd like you to know the contraindications and risks associated with aquatic therapy, explain the physical principles, the physiological responses of water immersion and exercise within the water, and know a little bit about the hydro pool, the equipment and the assistive equipment. Describe some of the conventional methods such as Badgergath's ring method, the Halliwick and deep water running, and ultimately you want to be creating an appropriate exercise program for your patient. So the Aquatic Therapy Association of Chartered Physiotherapists in 2008 changed the name from hydrotherapy to aquatic therapy, but it's still used interchangeably. So aquatic therapy is a therapeutic program utilizing the properties of water designed by a suitably qualified physiotherapist specifically for an individual to improve function, carried out by appropriately trained personnel, ideally in a purpose-built and suitably heated hydrotherapy pool. So that's what we're after. The hydrotherapy or aquatic therapy is a broad range of approaches that take advantage of the physical properties of water, such as temperature, hydrostatic pressure, in order to stimulate blood flow and treat symptoms of certain diseases. Exercising in warm water is really quite relaxing and is going to improve muscle activity because muscles work better when they're warm. So it's got many benefits over land-based therapies. We're going to cover some of the principles now. But before we do, we need to highlight the hazards of hydrotherapy. Obviously, the main concern is drowning. You can drown in a very shallow amount of water, and you've got to make sure that if your patient has a significant disability where they can't look after their body position or indeed their airway, then they probably shouldn't be there. You've got to be careful about heat exhaustion because the pool is hot, slips, trips and falls, any sorts of infection, pool entry and exit, skin irritations, droplet infections such as Legionella disease, electric shocks, and otitis externa or swimmer's ear, basically an infected ear, does happen. So safety, you can read the risk management. What that's doing is it's taking into account that you've thought about all the risks, that there is a lifeguard if you're using a swimming pool, that getting in and out of the pool has been thought about, that the pool is at the right pH and the right temperature. You know your evacuation procedure, people are wearing the appropriate footwear, and you're not running or playing in the area. You've got to make sure that the water is monitored, and that's normally the estates people that are looking after that. And you've obviously got to report any incidents as well. So this is more concerned with the people that look after the pool, but we still need to be aware of it. So contraindications, absolute contraindications, they should not be coming in the pool. If you've got acute diarrhea, vomiting, a recent MI, or you've got resting angina, any sort of wound that's infected, any skin irritation, recent neurological events, if you're having chemo or radiotherapy for cancer, if you've had a DVT or a PE, if you're incontinent, If you have a sexually transmitted infection, I'm not sure on that one. Widespread MRSA, acute increased temperature, shortness of breath at rest. If you're over 21 stone or 130 kilos, if you've got uncontrolled epilepsy or diabetes, these are absolute contraindications. Some of the precautions would be fear of water, obviously, controlled epilepsy because of the drowning risk, haemophilia, high or low blood pressure because of blacking out and they're not being able to maintain a patent airway, poor skin integrity, pregnancy, if the water is too hot, early kidney disease, and any sort of impaired vision, sensation or hearing. So that's what you'll want to be thinking about. So the hydro pool itself is different from a normal swimming pool. It's a lot smaller and it's heated. So you can't have multiple patients within there. It's normally for a one-to-one or two therapists working at the same time. So a specialist in aquatic therapy will be a member of ATAP, and they will be using hydrotherapy on a daily basis. They will be experienced band 6 or band 7, and we're focusing in on the components of fitness that are required based on a needs analysis. And it might be that they start off individually and then they get pushed into a group environment, which is more likely in a swimming pool. So some of the principles of aquatic therapy will be the temperature of the water, hydrostatic pressure, turbulence, including drag, buoyancy and center of mass, and things like reverse muscle actions. So the warm water immersion is important because the hydro pool wants to be between 33 and 36 degrees centigrade. This is going to increase your blood pressure, increase your heart rate, and basically pump blood to the peripheries. Also, if the core body temperature rises above sort of 36 degrees, so 36 degrees is that optimal point, any more and your body core temperature gets too hot. So hydrostatic pressure, what is it? So water is going to exert a compressive force on the body. So this is the hydrostatic pressure. And this pressure can cause displacement of fluids within a person from the extremities towards the central cavity. That's why you might want to be going to the loo, all that sort of thing. So basically the hydrostatic pressure, if you're immersed up to your knees, that's going to be less hydrostatic pressure. If you're immersed up to your chest, more hydrostatic pressure, and if you're immersed up to your neck, that's a significant amount of hydrostatic pressure. Bearing in mind that more hydrostatic pressure is on the feet because the deeper you go, the more hydrostatic pressure is applied. So you can see exactly what I've just said there. The greater the depth, the more the hydrostatic pressure. So if you're fully submerged, it means that you've got a full body, a three-dimensional pressure being applied to that body part. And that's important, one of our therapies. So some of the things that we want to be doing in hydrotherapy, relieving pain, increasing range of movement. We can do some strengthening, we can do some cardiovascular conditioning. Sometimes we do gait re-education. That goes very well with balance and proprioception. And obviously we can do some adapted swimming should we require that. So buoyancy. When a body is immersed in water, there will be an upwards force exerted by the water on the body. Okay, so as your weight comes down, there'll be the same force effectively going up, and that will be equal to the weight of the water that's displaced by the body, and this is the force of buoyancy. So we've got gravity, the object, and then buoyancy. So the therapeutic effects of buoyancy is it's going to reduce weight bearing in the water. Great for people with osteoarthritis of the knee, the hip or the lower limb. It's going to reduce the effect of gravity. And it's going to help load bearing joints. You can do buoyancy resisted exercises working with gravity and against gravity using certain flotation devices, and this anti-gravity effect may cause a person to have a reduced perception of fatigue, conserving energy. Great for people with sort of fatigue issues. So the different types of buoyancy is we've got something that we refer to positively buoyant. That's someone that's going to float. Neutral buoyancy, where you're going to float right on the top of the water, and then negative buoyancy when you're going to sink. So the relative density of a human is just under 1. Anything that's under 1 is going to float as long as you've got your lungs inflated, and as soon as you breathe out, you're going to sink. So that's why we're doing that. This is something they do called drown proofing, where they breathe out to go to the bottom, and then as they come to the top, they breathe in and then breathe out, and so that you can sink and float, so you can proofing yourself against drowning. So turbulence. So as you move through water, then you're going to cause resistance, and that results in an area of low pressure behind the moving body part. So the faster this movement, the greater the resistance, and sometimes referred to as drag. So the larger the surface area, the greater resistance to the movement in the water. So effectively, when you put a pair of fins on, you're going to be faster. I remember quick reversals of direction will create resistance to movement. We use that in the Halliwick method a bit later on. So as we said, turbulence results in this area of low pressure behind the moving part. Okay, so here's the pressure here, here's that frictional drag, and you're creating a vortex behind you. Okay, so here you can see that you're creating more drag if you're higher in the water, whereas if you're slicker on the water, you've got less drag, so you'll be faster. So streamlining, this refers to making sure that the surface area of a body part is when moving through it. So this is the example of adding fins. So effectively the shape becomes better. You're just streamlining and you're reducing that drag. You'll see sort of motor cars do this in F1. So indications for any type of hydrotherapy. So non-specific debridement, as long as the wound is healed. Decrease in muscle guarding, if you want to increase range of movement. Anyone that's got hypersensitivity, things like allodynia, you want to decrease pain, promote relaxation, and promote, gravity-free buoyancy in a therapeutic environment. So remember our 6 steps to exercise progression. We might start with, for instance, the knee joint. We might want to isolate and educate, simply doing a quads contraction or using the resistance of the water. Then we're going to add some resistance, in this case the water. Then we might do some squatting in the water, because that's a functional position. Then we might do some squatting using the resistance of the water, where we're going a little bit faster, so creating that drag. And then we'll use multiple muscle groups, a core to extremity challenge, and then we'll add those components of fitness on, such as balance, speed, rotational movement, so on and so forth. So as we said before, so pain relief, the warm water and hydrostatic pressure help decrease nociception and promote relaxation. Increase mobility, because the hydropool is warm, muscles stretch better when they're warm. You can also use resistance of the movement to get a strengthening effect as well. Just by speeding up, you can increase that drag, can't you? You can work the cardiovascular and cardiorespiratory system in the water, because people might not be able to effectively work for more than 2 minutes, so they can't access their cardiovascular system on land, but they can access that in the pool. Things great for gait re-education, learning how to walk again, and using balance and proprioception. So some of the tools of the trade here. Here's the all-important aqua jogging belt. We've got some flotation dumbbells, and these things are called woggles. Yes, woggles. Okay. We've got some different types of hydrotherapy that we use. We've got some general water-assisted mobility. This is the most common type of hydrotherapy. And then we've got the Badger gas ring method, which we use for patients with significant impairments, neurological patients. The Halliwick method, which is used for pediatrics. And then deep water running, which is a great way of getting someone moving if they've been inactive for a long period of time. So the Badger gas ring method, the therapist is providing a manual resistance, and normally the patient is relaxed back, their head is supported, they're lying in a supine position, they're supported on lots of different flotation aids, and they'll just be using the resistance, using the drag to move in and out. It can be really, really nice feeling for someone to get out of their wheelchair and experience that feeling of floating and actually being more in control than they are when they're on land. The Halliwick method is more for pediatrics, working on various different principles such as rotational control and control within the water environment. It's a problem-solving approach that is based on a 10-point program, which we'll show you in a minute. And then things like deep water running, which is great really for getting the heart and lungs working, aerobic conditioning, while someone can't actually work out because they've got an injury. So badger gas ring method, developed in Switzerland. The rings refer to the floats because the head is supported